Welcome, everyone, and thank you for joining us for today's roundtable discussion titled Language Opens Doors Supporting Refugees and Immigrants. Language access is far more than communication. I've always said this, it is connection, it's dignity, trust, and opportunity. For refugees and immigrant communities, the ability to fully understand and be understood can directly impact access to healthcare, education, legal services, employment, public benefits, and the overall integration into the society that we have welcomed them into. Today's conversation brings together professionals and community leaders who are passionate about breaking language barriers and creating more inclusive environments for individuals and families navigating new systems, brand new cultures, brand new experiences, and through this discussion, we hope to share new perspectives, some challenges, and maybe best practices and meaningful solutions that will help fortify support for multilingual communities. We appreciate everyone taking the time to participate and to contribute to this important dialogue. And we look forward to a thoughtful and impactful conversation. Just as a reminder, you're welcome to share your questions, and we will be glad to discuss those as well. With no further ado, allow me to introduce myself and pass it on to today's speakers as well. My name is Katherine Adames, and I am the Director of Interpreting Operations at Effectiff. I've spent over 20 years working in the language access field. I began my career as an interpreter, and I've grown into operational leadership. My work, it's very fun, truthfully, and it focuses on improving access to interpretation services across healthcare, education, legal, and public sectors while helping organizations create a more inclusive and equitable experience for multilingual communities. And that falls in my community as well. I'm excited to be part of today's conversation, and I hope that you all find it fruitful. With me today, Khadija, please go ahead and introduce yourself.
Hello, my name is Khadija Muhammad, and I'm the founder's lead consultant at Blackstar Consulting LLC. It's an organization that focuses on improving impact program implementation within immigrant communities and the diaspora. I also work with the Language Justice Collaborative, which includes 6 language organizations in New York City that works to drive policy and change within the language access framework. And I am the program manager for language access at African Communities Together, where I manage the first African language cooperative that provides language access services to the African community within New York City. So yeah, that's
Well,
about it.
what a wonderful work you have. What a wonderful work you have. Thank you so much.
Thank
Jesus?
you.
Good afternoon, everyone. My name is Dr. Jesus Pash. I work for Monroe County, and in my role, what I do is I make sure that all 40 departments and divisions have meaningful language accessibility for our residents and also for the workforce. So I'm very happy to be here today and looking forward to our conversation.
Very excited to have the both of you, and thank you so much for taking the time to be here with us today. All right, so let's go into subject. If a refugee or immigrant walked into an organization today and could redesign the experience from their perspective, what would they tell us to change first? Khadija, you want to go first?
Sure. I believe the first thing they would say, they would ask for is dignity, like you mentioned in your opening. Dignity before documentation. Often, when immigrants walk into an office, it's always your ID, your papers, your this, your that. And these people come into these establishments with carrying a load of grief, trauma, uncertainty, just the culture shock, and sometimes the language barrier, as we are discussing here today. So, just making it a human centered approach when they walk into these organizations relieves them of the burden they're bringing in and allows for better communication and a better relationship building, even if it's just for the period for which you're providing that service. I also think that they probably will say treat them with dignity, but then also remember that their language barrier is not incompetence. Because sometimes, because there's the language barrier and because of the language non-proficiency, there's this feeling, this tangible feeling that you cannot describe when you're dealing with somebody that makes you feel like you are not capable. Almost like, do you understand what I'm saying? And you're like, I kind of do. I just didn't need you to make me feel dumb in this moment. So it's just really understanding that, yes, these people might not be proficient in English as yet, but these people are sometimes engineers from where they come from, community leaders. They are competent, they are intelligent. It's just a
Mhm.
temporary language barrier. And therefore, that is what I believe um, they would ask for. And for us as organizations to also understand and redesign our organizations to feel more human in the sense that we provide clearer communication. Because sometimes, as people in the field, you know what you know, right? So when you're talking to somebody that walks into your office, you have this knowledge bias that it makes you speak quickly. It makes you speak over people's heads with the jargons and the technicalities. And this is someone who is probably trying to translate your language into three different languages in their heads before processing what you're saying. So just also remembering that clearer communication is important. Culturally responsive staff. Many times I've walked into spaces where language access, there's a sign saying, oh, we can get any language for you. But the person in the front, it's almost like the sign is there, but the person is oblivious of the sign. So there's a disconnect with the cultural responsiveness that's being portrayed on the wall and the actual human that's providing the service. And also sometimes providing the interpretation without making us feel ashamed for asking for it. Or maybe don't let us ask for it, offer it, right? So that we can take out the shame and then people can be able to access the service and the information they need to be able to make informed decisions, right? And lastly, just building more trust. I think that takes us a long way in this work. Just the trust that you're not going to take my word and misunderstand it, misconstrue it, and use it against. Yeah, I
That
think that would be it for me.
I completely agree. I think human connection overall, especially when you're coming from a very sensitive place, is so important. And if you walk into that human connection, human touch, understanding, and maybe simplifying some of the processes for specific, um, you know, folks that are coming into our community that have struggled too much before, I think definitely makes a change. Thank you so much, Khadija. Jesus?
I think this is a great question. First, I have to acknowledge that we in the organization we a lot of times work with community leaders, and also we work with the consumers directly to hear what they have to say about our programs. We think that that's essential for us to know where we're going and if we are achieving our objective. So, what we have heard from new Americans and refugees, because we work with the organization, is that we have made significant changes, positive changes, and now we have been able to serve the community, the immigrant community, the refugees as well. So I think that we will hear positive news from them. However, we still need to make some changes. And one of the things that we need to continue to do is monitor the changes that we have in our community. For instance, last week I had a conversation with one of our clients, and the person stated that we will be receiving new Americans or refugees from Africa, and he asked me if we have this language in African language in the vendors that we use to provide services. And we right now use a vendor that provides services in 350 languages. So when I went back and assessed if we had this language, we did not have it. So this is an area where we have a gap, and we need to address it. So that's something that we need to go back to the vendors and see how they can support us to make sure that we're able to support our new Americans and refugees. So having great communication with the stakeholders in the community, I think that's significant for us to continue to redesign our program or monitor the changes that are occurring in the community so we can be effective in delivering language accessibility. So, with that, I also think that what both of you mentioned about training the culture in the organization, I think that's significant because many of our employees sometimes don't know what the refugees or new Americans go through before they reach our organization to get the services. So, addressing biases, training about what biases are, cultural differences, making sure they are aware of their own biases, I think that's significant. So, these are key areas that we need to redesign, make sure that when our employees come to the organization, they already know about, or they not that they already know, but they are receiving this training as part of the onboarding assignments. So once they are on the field, they know what to expect. So definitely, this is an area that we will continue to work on.
Thank you so much, Jesus. We have been dealing with refugees and obviously immigrants for ever, right? Something that caught my attention, and I've been directing for over 15 years now, is one specific organization that before they received new Americans or refugees or new immigrants, they would come to us, just like probably you did, Jesus, and let us know, hey, we're going to have people coming from this and that region. We may need more interpreters this and that date. And I think that right there is very significant. Understanding their needs, maybe investigating about the region they're coming from. We as LSPs, and I know that from my team, we've had to educate some of our clients and say, okay, I know the country is X, Y, and Z, but they speak XYZ languages there. It's not just one language, and you may encounter this happening often. Another thing is that for us as language service providers, we see refugees as also assistants, right? Some of these people, like Khadija was saying, they're very educated. They're coming with many more than one language already in their pocket. They're willing to assist their own communities. And we have had the assistance from refugees as interpreters, welcoming with our training, welcoming, the new Americans that in any date could walk in. And I think that's also important. Refugees are not only coming in to get assistance, but they're also very willing to help out their communities. Thank you both for your responses. All right, moving on. I love this one. I think it's pretty interesting. What is one assumption organizations make about language access that sounds right, but is actually wrong? Jesus?
Uh, Something that I've noticed is that many organizations, when they hear language accessibility, they think about translation, using Google Translate, or just translate their materials. So when they have community engagement, they just can provide the information. However, the big challenge is once you promote your program and the consumer comes to the organization, what will you do? Right? They have not conducted an assessment to monitor each step of the steps that the consumer will go through to receive the service. I think that's the big gap that I've noticed working with different organizations, and especially when they serve multicultural environments, right? So there's a big gap. I think that they do not understand what language access is, and they do not understand that language access correlates with their mission and vision. I think that's the biggest gap, because if you deliver the message that, let's say, you provide mental health services, and you focus on delivering these services to make sure that your community thrives, right? But you're in a multicultural environment where your residents are multicultural. They speak different languages. So now you have a big gap. You're not meeting your mission and vision, right? Because you do not have the resources in place to serve your residents. So you're probably serving 40 to 50% of your residents, and I think that's the gap. So I think that there needs to be a better understanding about how language access correlates with your mission and vision, and then the process that you have in your organization to deliver your services.
Definitely. I think what we've seen, and as one of the biggest issues as we service communities, is lack of training to organizations' employees. And I know that Khadija mentioned that previously. And part of that training has to be cultural awareness. And I think in every webinar roundtable that we have led, we've discussed the same thing. If you're going to offer a service such as language access, because it is a service to your community, you want to make sure that your employees, as the first to provide, are able to be cultural aware, that they have the correct training, and that you as an organization understand that as soon as someone walks into your organization, you should have this service available. You should have the technology, you should have it, like I said, accessible, you should have a workflow already designed, and you have to be consistent with the training. Some people forget, one employee comes and leaves, and then the one that is going to replace doesn't know about language access, doesn't know about the community and the languages that they speak. So I completely agree with you, Jesus. Khadija, please go ahead.
Yeah. So before I respond to this question, I just wanted to add to the previous comment that you made about using the refugees and immigrants for interpretation and kind of leveraging the knowledge and expertise that they're coming with so that they're not just here for needs, but also we get to use them for their expertise. So I just wanted to give you an example of what the Language Justice Collaborative has done in New York City, which is to create worker-owned cooperatives owned by the immigrants themselves,
Oh,
train them, create a training system where they get trained in community interpretation. And of course, they are given the trauma informed interpretation as well. They're given medical terminology interpretation as well as the language of justice, because again, it's refugees and immigrants. At
mhm.
some point, you're going to need an interpreter when you're going to prepare for your hearing with your lawyer or anything like that. So it's been incredibly successful. And what I truly find remarkable about that system of creating language service cooperatives owned by the immigrants themselves is that not only are you providing language access, but you're providing culturally sensitive, highly trained interpretation and language access, but also creating economic and civic
Mhm.
empowerment. Because now they do understand that their voices matter. They get the situation that the other immigrants and refugees are in. And they are also able, you also mentioned about the fact that if somebody comes from XYZ country, they might speak XYZ languages. But especially with Africa, they might speak A, B, C, D, E dialects of their X, Y, Z
That is
languages, right? So to have these people with this kind of information and just knowledge and expertise of a language that you could never study in class enough. No amount of PhD
correct.
will give you that kind of nuance that comes with a native speaking a language and just using that to provide the services that is needed for the community by the community and thereby empowering that community. I just think it's an amazing thing that the Language Justice Collaborative has done in New York. Okay, moving right along to this question. I totally agree with Jesus about translation not being enough because again, jargons, terminologies that these people don't understand. And people seem to lose sight of the fact that I think the United States of America is like one of two or three federal systems in the world, which means that this system of governance is very different to many people outside of the United States, which also means that services, offices, agencies are brand new to most refugees and immigrants.
Mhm.
Therefore, terminologies and languages used in these pamphlets and flyers are equally new. And sometimes, even when you do the translation, you don't find the exact word or
Mhm.
expression to translate what you're trying to say on paper. Therefore, again, I totally agree with you, Jesus, that translation is not enough. But my point is the idea, the assumption that it's perfectly fine for the family member to do the interpretation, because that's the assumption that we run by sometimes. Because somebody comes to the hospital, they're with their granddaughter, they come to the office, they with their granddaughter, and can you tell your grandma, can you, and this goes on all the time. But that in itself is burdening the child with something that they might not be prepared for. Don't even talk about the ethics and just the whole professionalism that comes with actual interpreting that this child has no idea of. And sometimes they could be putting their grandparent in jeopardy just by interpreting. But then somehow we as a service community have almost embraced the fact that, oh, there's somebody, they'll do it. And I think that's not a good way to go. It's important that if possible, always offer the professional interpreter at least. So yeah, I just think that language access, it's, for me, really, it's not a service. I think you cannot create a program in today's United States of America and have language service as an afterthought. It can't be the service that's added on. It has to be part of the designing of the program. It just cannot come afterwards. That's just how I feel about language service. Because unless you just want to check a box and say, oh, we provided XYZ languages for interpretation at this webinar, then you want to be thinking of language access at the drawing board as the concept is being formed, as the as we are operationalizing the program, because language access doesn't exist by itself. That's that's what I think.
And to piggyback on what you're saying, I think something that organization needs to do as well is uh, implement language accessibility into their human resources practices, right?
Mhm.
Because then, if you, let's say, recruit immigrants that are bilingual, then the quality of service can increase, right? Because now you're not paying for a vendor to translate. Now you're creating jobs. And you hire a person that's qualified, and here's where I put a lot of emphasis: someone that's qualified, that's bilingual, and that can deliver the service that you're trying to deliver, right? And I think there's where your quality of service can improve, because the person can create a relationship with the customer, and then you build trust, as you mentioned previously, and then your organization will be an example for others, right? So I think assessing your recruitment practices and your just human resources trainings, etc., that can also help deliver high quality services in your organization.
At the end of the day, your first clients are internal. Your employees, your staff members are your first clients. I see this done a lot with the ASL community, the American Sign Language communities. I see HR advocating for having someone to train, to partner with this new employee, and I would completely agree if this is done also for other spoken languages. Okay, moving on now to this other question, which is also very interesting. And I am just reviewing some names of people that are listening in and watching us today. We have Kinyarwanda speakers, we have Swahili speakers, Kirundi speakers from East Africa. We have people from Nigeria listening in. We have people from Kenya listening in, Austin, Texas, from Cairo, Ethiopia, Peru, California, Kansas. We have a lot of folks listening in. Thank you so much. And do share your questions. We'll be glad to have an opportunity to answer those for you. Okay. Can language access do more than remove barriers? I think we talked a little bit about this already, but let's see what else we can add. Can it actively create opportunities? And what have you seen? I think Khadija did mention a lot from that. And I think the three of us may be an example. We are most likely immigrants. And I think language access has already created an opportunity for me. Um, my first job has been as an interpreter, and being able to help my community is one of the greatest. It makes me feel really proud. So absolutely yes, it does transform relationship outcomes everywhere, and it's the biggest opportunity of my life, I would say. But I'll let you guys answer to that as well.
Yeah. It, it goes without saying at this point, right? It just goes without saying. And just to add to the Afrolingual anecdote I gave before, there's this other program that the DOE created for immigrant families, just to bring the two generations together, the immigrant generation and then the first generation Americans. Because again, perspectives are different, and they're trying to kind of create um, that sacred space and time where parents are able to engage with their kids and other parents and other kids and just share their stories, their perspectives, whilst we share the American story, the American history, the importance of advocacy and community. Now, I have run this program now. Black Star has implemented this program now 4 times. Every single time we start the program and it's quiet, crickets. You try all the techniques to have people kind of feel safe enough to share their immigration stories. Mind you, the climate is not very conducive to tell people who you are and what your status is, right? But then we try to just make it as safe and as warm as possible. And by the it's an 8 session program. By the fourth session, the parents that were hiding behind the cameras turn on the cameras.
Oh, wow.
The kids that would you'd see the parent pushing the kid, say something, say something. This kid is like, no, no, no. By the fifth session, they're reading the books out loud with an accent, with all the errors, but still confident. And by the eighth session, it's like, who can I bring in? They become community advocates themselves. The parents become community liaisons. They start recruiting other families. And these are people who were shrinking themselves because they didn't fit in, because they didn't feel like there was a place for them, that they couldn't be seen. But once we started speaking their languages, started celebrating the little innuendos about their cultures, and sometimes we talk about all the things that we see about other people's cultures and we go like, ew, why are they doing that? And then when you turn that mirror around and you say, do you see how somebody else can see your culture and go like, that's weird? Then maybe we could all like have a little warmth and openness when it comes to other cultures and other languages and things that we just don't know about. But you see these people, and I have watched two people, one become an actual tester and trainer, and another become this amazing community organizer. And these are women who didn't have jobs, but just because there was a program that said, we are going to see you and hear you and make sure you understand that your multilingualism is your superpower, these women are thriving and their kids, they feel untouchable. And you know how the kids go with all these lingos like, oh, she ain't it. And they're doing all these things. And before they were hiding. So for me, it goes without saying. There's no question about that.
Like we said before, that human touch brings in that sense of belonging that is so important for humans, right? So to be able to feel understood, to be able to feel heard. I think one of the biggest breakthroughs, I guess, from where I'm sitting is seeing parents that are immigrants that were seeing their children struggling in education, parents of children that are or were very sick being able to understand their treatment, understand their condition and why their child was maybe not learning as fast as another child, and talking to the teachers and opening up and talking about situations from their home is also just a breakthrough, as someone who's sending interpreters and also assisting as an interpreter. To be honest with you, I've always, and you mentioned this, I've always felt as if knowing a second language or a third language or a dialect is a superpower. It
Yes.
definitely creates a difference when you're having a conversation, and as a person, it makes you feel as if you're doing something fulfilling in life. And I think that has to be also part of interpreter training, that you understand that what you're doing is absolutely wonderful. You're opening opportunities for other people. You're probably changing someone's lives. I love to see it that way. So thank you for mentioning that. I'll let Jesus take over now, please.
This question makes me think about the time that I got to America when I went to college. I remember that when I had assignments, I wrote them in my language in Papiamento, which is the language from Aruba. And then the assignments, I had to do my best to translate it into English. And I remember that I spent a lot of time in the tutoring section where they were providing assistance for those that speak a different language. So, because of that assistant for immigrants or those that did not speak English as first language, I think that's why I'm here today. I recall that my wife used to say that, and she still says it sometimes, that when she met me, I barely was able to speak English, but now we're able to have a really nice conversation, right? And I think it's because of that support for language access. And I think that language access provides resources and it empowers individuals. And I look at myself right now and the job that I do, I'm working for a government institution, empowering uh, thousands and thousands of um, residents here in Monroe County through language accessibility, right? So it all started when I came here to America, the accessibility that they had in the program, and so on. I can also mention that by providing language accessibility, we're promoting an environment that's safe for those that do not speak English and for people to prosper. I think that many refugees that come to America, as you both mentioned, were professionals in their country. I have worked with different individuals that in their country they were medical providers, but because of the standards that we have here is different, and they started from zero, right? But there are people that are very, very smart. When you sit and have a conversation with them, you see that they're intelligent, and I think that this creates opportunity. Language access creates jobs as well, depending where you are. Let's say here in New York, it creates jobs for community members to prosper. So I definitely think that language access correlate with different things in our community that empower our residents. So I that's what I do for the organization and also for the community because I believe in the power of language accessibility.
Beautifully said. Thank you so much, Jesus. Let me see. I think we have more people joining us today. I saw, let me go back here, from San Francisco. Hello, Alex. We have Maria from Akron, Ohio. We have Mary from Minneapolis. We have a user from the Philippines. Again, Nigeria, Haitian Creole speaker, and also French speaker. And we also have uh, folks listening in from New York City, Turkey. So thank you so much for taking the time to be with us today. We're hoping that this conversation is very interesting for you as well. Okay, what is one small action organizations often overlook that could dramatically improve the experience of refugees and immigrant communities? Who would want to go first for this one?
I think organizations they do they do not look at the data in their demographics, and I think a lot of times they do not make informed decisions. So many times you see that organizations just try to deliver a service, and they do not monitor the data in their demographics, and they also do not gather data once they have implemented that language access strategy, right? So I think you can gather or assess data from the census to have a general idea. However, I think it's very important to gather your own data. For instance, we use a vendor that helps us monitor the services or the languages that we provide the services in, and that's very helpful because right now we have implemented Monroe Alert, and this is an emergency management system where after you sign up you are able to receive alert messages in multiple languages. So we have been able to address which are the most common languages that we provide services in, and not just make assumptions of what we think will work, right? So, especially in an emergency situation, you want to make sure that you have the correct languages, and you're also using resources effectively. So, I think using data to your advantage is very important. And a lot of times, um, organizations do not make informed decisions, and it's unfortunate.
Thank you so much, Jesus. Khadija?
Yeah, I just like the low hanging fruits. Just ask people, how would you prefer for us to communicate with you? How would you prefer to be communicated with? Because most of the time organizations assume that emails and portals and all, the long written documents and the formal meetings is how people like to be communicated with. And again, just because it's the formal way to do things doesn't mean that it's going to work in a space such as language access. So for instance, we train community interpreters, and I can tell you they will not read your email
Mhm.
nor the long memo you sent them. But what they will do is leave you a voice note, listen to your voice note, and respond with another voice note. They would respond to you on WhatsApp, phone calls, using people they know, like community ambassadors, translation videos instead of just a script. Because again, we have this assumption that people that speak certain languages read the languages. And that's not true. Because I could speak French and not be able to read French.
Mhm.
And that's a natural occurrence, right? So just translating things into these flyers and documents doesn't mean that you're providing the language access that is needed by the community. So sometimes just using the translated videos and also trusted cultural messages. Because again, we have to be culturally sensitive. And most of these communities, especially from my neck of the woods, Africa, we love our community leaders. We will trust anything they say. We will follow them to the end of the world and back, but we will not read your flyer. So again, I love I love what Jesus said about data because you cannot use a broad brush to paint the whole, demographic. That is something that I find that organizations do a lot. Oh yeah, these are African language speakers, so we have these, main ideas that we have about them. But even with each African country comes many African ethnic groups, dialects, and mini dialects. So it's never really that straightforward. Just taking the time again to gather the information, synthesize the data, analyze the data, and use whatever the data is telling you to create these programs, and also communicating in a way that allows people to ask for help and feel confident and safe enough to say, I don't understand what you just said. I think that that is one small action that we can do.
I think one advice that I can give all of our clients, all of the organizations that are probably listening in or will watch this video later, is to create a language access plan. And it talks about what you guys mentioned. It talks about gathering data. I'm reading off from my cheat sheet here, but it talks about most common languages that are spoken, the opportunity for new languages, the type of services that are most frequently requested, cultures. Someone in our chat here in our comments mentioned culture. It is so welcoming for someone to understand where you're coming from, the language that you speak, where they speak that language, and maybe why you're here. You need to evaluate current gaps. Everything is about the data. And I think we have nothing else to add to this question. Make sure that you understand fully who you're servicing, and, take it from there. And after you gather the data and you get all this wonderful information, make sure that your staff is fully aware of why we're offering this service and why it is so important to have someone, as soon as a refugee or immigrant walks in, maybe try to understand them in their language. Okay, let me see if we have any questions here. I don't think we do, so we can move on to our last question. Very interesting. Fast forward 5 years. What would success look like if we truly got language access right for refugees and immigrants? Wow. Hmm. Hmm.
I think right now Monroe County is in the on the right path. Why? Because we are serving our customers in over 350 languages, and the feedback that I receive from staff members that work in the DMV department is that we are getting consumers from other counties that are addressing their needs in the DMV because of in our DMV because of the language accessibility that we have. So I think we are on the right path. What I would like to see in the next 5 years is a culture change. I think where we have where we're not using VRI to provide services, where we're using more of our residents working directly with those that come in and speak a different language. I would like to see for us to have processes in place where immigrants and refugees that when they come to the organization, we're able to inform them about all of our human resources benefits of our 401k, our pensions. Many times we do not um, see immigrants benefit from those opportunities because as immigrants we just come in and we want to work, we see the opportunity, we want to work, 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 work. However, there's gaps where sometimes we miss. And I think informing them about a 401k, a pension, leading them into financial success, right? That you're not only going to work, but you also can get a 3% match. You also can get other benefits from your employer. So I think those are small areas that I would like to see a change in the next 5 years, and that it will just be natural that we just have programs in place that will address these areas. So there's where I would like to take the organization, and I would like to see a lot of people wanting to work for Monroe County. That's my objective.
Well, that's very likely advocating, very nice advocating for your community. From, I guess I would want to answer after, and I would want to advocate for my community of interpreters that do service through VRI. You mentioned using less VRI. In my eyes, it would be using more of these services that are virtual, and understanding that not always on it. Well, there are certain situations, and I would like to clarify first. There are certain situations, obviously, especially for communities in which on-site interpreters are preferred, maybe for refugee services and things like this. But I would, and I will always advocate for virtual. I would like to have the opportunity and for people to understand that sometimes communication with a virtual interpreter is the same as if you have someone there with you on site. For mental health, refugee services, maybe not so much, but the work that I see these interpreters do, the terminology that they manage, the way that they manage their time, just the way that they have been able to position themselves to service our communities is fantastic. And I would also like to see more opportunities given to the immigrants, the refugees, without maybe the nation thinking that we're competing. They're here for the same reason. And at the end of the day, what we all want is for this country to grow. So we would want to kind of eliminate that competitive or competition, maybe side from a sentence, and
Mm-hmm.
just make it be as if, hey, we belong. This is just, we're doing for your community the same that you're probably would want to do for your community. And I would want to see more technology. I think that AI is that scary word, but we would want to see AI also assisting with this very sensitive communities as well. More communication, more cultural awareness. I think I'm going to just take a pause because maybe I won't stop, and I'll let Khadija take over.
Please don't stop.
So
Don't
much
stop,
change that we
won't
need.
stop, can't
So much
stop.
change that we need.
Yes, it gets, we all get passionate at some point. Like, okay, okay, let it go now. But fast forward for me 5 years, I'm thinking success would mean language access is no longer treated as an afterthought or a special accommodation that's being provided, but as a normal and expected part of inclusive service delivery. I would also want multilingual communication to be embedded across healthcare, education, workforce development, and public services so that it's not that you're, I've been in the emergency room, you're in the emergency room, somebody comes in, can't speak a word, it's an emergency, and we're scrambling to find someone to say what is wrong with this person. And that's not the best. So my vision of language access in the next 5 years will to have multilingual communication embedded in healthcare, education, workforce development, and public service, and also for refugees and immigrants, immigrant voices to be included in leadership and decision making. Oftentimes, we sit in the boardrooms, we sit in the strategy meetings, and we are formulating policy and strategies about people we know nothing about people whose realities we have no idea about. But then we transpose and transplant all our ideas and say, oh, this is an amazing program. And then we implement it and we realize, and then instead of going back to the drawing board, we blame the supposed service recipient, right? So for me, it's just embedding it and adding them at the beginning, at the initiation stage. And really, why are we doing what we're doing? I don't. Sometimes, sometimes, just in this work, sometimes it feels like we are checking off boxes and we are filling quotas. And in 5 years, I don't want it to feel like that. I want it to feel like we want to help people help themselves and help this country because that's the only way this works. And also increased funding.
Mm,
I would love to see
that one is a big one.
increase
Yeah.
increased funding because that way we can compensate the community interpreters who are invaluable. I keep saying you can study Swahili all you want. Study Swahili in Oxford, study it in Harvard. You will not be a better Swahili interpreter If a native Swahili speaker gets the training that is required, the qualification that is required. So I think that we need to be able to compensate them for the work they do and even create some form of a career path. Because right now, I don't know about Monroe County, I know about what's going on your end, but it feels almost like it's a part-time thing for them. And it's a cycle. If I cannot rely on it, I cannot give it my all. Who suffers? Immigrants and refugees. So that's why I'd like to see more funding. And also, just beyond systems, fixing funding, policy, and all that, I would love, for me, success would really feel different emotionally, right? Where families would no longer walk into institutions feeling intimidated or invisible,
Mm-hmm.
right? Parents would confidently advocate for their children.
Mm-hmm.
Just last week, I had two parents. They are at their wits' end because they are multilingual, not their LEPs, their language. They're not very proficient in English, and their child keeps being sent to what's the place they put the kids? Detention. Every day, the child is in detention. Now they are at their wits' end, and in their minds, the best solution is to take them back home.
Oh,
And that's not the best solution. But because they cannot figure out how to advocate and advocate effectively for their kids, that's where they're at. So, yes, a situation where parents feel confident enough to advocate for their kids and for community members to also engage earlier on instead of waiting until there's crisis so that they also feel like they belong. It's the
yes.
sense of belongingness. I will give you my arms and my limb if
Mm-hmm.
I feel included, if I feel like I belong, if I feel like you want me here.
Mm-hmm.
And that's
Yes.
all.
Yes. Yes. I do want to read off just a few comments here. Marjorie, I don't think we have the full length of what you wanted to express, but I think it's important that I clear this out. You wrote, language access organizations need to provide assistance for roadside accidents, to render interpretation via phone, to communicate with the reporting police officer on site who will be issuing the report, to take the perspective of the LEP. I want to clarify that this service is already being provided. If you're, I'll be glad to discuss further. But one of the services that we do provide is either 911 or roadside assistance for events like this, that we make sure that all of the information that is being provided by the officer, the limited English proficient person, understands. It is very important for them to know what else they can, what else comes from this. And then we also have, it says LinkedIn user. In healthcare, some providers can wait to get rid of in person interpretation. If they could, they would just hand a translated pamphlet and call it an appointment. Well, that will be very sad, and I'm sure that it will fail. Okay, it will definitely fail. Let me see. Utilizes AI to, Deborah says, okay. I think someone, I'm trying to find the comment, but someone requested, and I think it's an interpreter, that our next discussion talks about AI and how we can utilize this for interpreting. I would love. We did something very similar. We talked about something very similar, but I would love to touch on that in the near future. I guess it is our time to conclude, just to be respectful of everyone's time. And I want to thank everyone, especially Jesus and Khadija, for taking the time to participate in this important conversation. I personally believe that supporting refugees and immigrants communities requires more than good intentions. It requires commitment, collaboration, and systems that truly are accessible and provide dignity and inclusion. This I always repeat. Language access has the power not to only remove barriers, but to build trust, to make our community stronger, and to create opportunities for individuals and families navigating this unfamiliar system. I truly appreciate the perspectives that you shared today, your experiences, and your ideas. And I hope the conversation encourages all of us to continue advocating for more inclusive, equitable service to be provided to our communities. Thank you again for being here and for the work that each of you do, including the interpreters and everyone else on listening and watching us. Once again, thank you so much, and we'll see you on our next webinar. Have a good rest of
Welcome.